Oh, hello, good morning, good afternoon. Thank you so much for joining us today. On behalf of University of North Carolina at Chapel Hill and USAID Advancing Nutrition, once again, thank you for joining for this meeting, the FINE COP, or the Family Inclusion and Nutrition Through Engagement Community Practice. My name is Neha Javeri. I am a social behavior change specialist with USAID Advancing Nutrition. And I'll just say it once more, if you haven't already introduced yourself in the chat, please go ahead and do so, including where you're joining us from and what organization you're part of. For today's session, we will be focusing on engaging men in maternal and child nutrition activities. So I wanted to take the opportunity to announce something we're very excited about. We have launched a FINE COP listserv, and this will be a space for meeting announcements, recordings, sharing of resources, and an additional opportunity for participants to communicate with one another outside of these meetings. So all current members have been added, but if you are new here and you would like to be part of this listserv, we'll be sharing a link in the chat. It's also, I think this is a hyperlinked chat box that I've added in the slide. So you can go ahead and click that and share your information with us. And I will start now with an overview of the agenda. But before I do that, I just want to let everyone know, in case you aren't aware or haven't had a chance to look back, we do update our webpage or FINE COP webpage with all of our previous recordings from the presentations and the speakers that we've had. So please do go ahead and check that out. We will also share that link in the chat. So we'll start off today's meeting with an overview of the do's and don'ts for engaging men and boys, which was developed by the USAID Interagency Gender Working Group's Male Engagement Taskforce. And then we'll hear about Rede Hopem and the work being done to engage men and boys in Mozambique. And after which we will move into small groups to discuss some important considerations with male engagement. So I will now turn it over to Danette Wilkins, who is a program officer with the Johns Hopkins Center for Communication Programs and a member of the Sexual and Reproductive Health Core Team for Breakthrough Action, which is USAID's flagship social and behavior change program. In their current role, they provide technical assistance and support to Breakthrough Action colleagues and partners on applying social and behavior change approaches and strategies to improve sexual and reproductive health outcomes globally. And now I'll turn it over to you, Danette.
Thank you so much, Neha. It's such a pleasure to be here with you all today. As mentioned, I work specifically in sexual and reproductive health, and I'm so pleased to be with you all today who are more immersed in the nutrition space, because it's so important that across our health focus areas, we're talking about male engagement for cross-learning. Neha already gave me a lovely introduction, so let's go ahead and move to the next slide. So in addition to representing the Breakthrough Action Project that I work on, I'm also here representing the Male Engagement Taskforce, which is an information advocacy and knowledge exchange network that examines how to engage men and boys in health promotion, gender equality, and explores across different health areas what we can do to further research and practice that can help us to consider best promising and emergency practices for increasing male engagement. And I'm going to drop a link in the chat to our webpage for those who are interested in looking at it further later on. Next slide, please. These are all the co-chairs and the contributors to the Male Engagement Task Force. And I imagine some of you have participated in some of our virtual events, and we'll be hosting another one in September, and really encourage as many folks as possible to join and contribute to this discussion and thinking. Next slide, please. And then what I'm here to highlight today is a product that was developed by the Male Engagement Task Force a few years ago, but that continues to be disseminated and translated into other languages. So the do's and don'ts for engaging men and boys, it's a easy to read 2-pager with really important considerations for engaging men and boys in health promotion and gender equity. So it's not specific to a health focus area for a reason. It really is the bubbling up of all of these best practices from the last few decades of doing this work around male engagement. And I say this also wanting to acknowledge that we still have a lot more to learn and do going forward. It's a key resource that can be used to guide decision-making about programs, policy, media coverage, research, funding priorities, you name it. So I really want folks to realize that this is a resource that can be consulted by anyone who's interested in furthering male engagement work. It's currently available in English, French, Spanish, and Portuguese. We're in the process of uploading a Kiswahili translation. And if folks don't mind, I'd love to hear in the chat at any point of other languages that folks think it might be useful to translate this into further. We'll be doing some more translations in the coming years. And right now I'm going to go ahead and drop a link to this resource for folks to be able to consult later. Next slide, please. So I wanted to share a little bit about the development process for the do's and don'ts, because it was a really thoughtful, intentional process that really was benefiting from the learnings of researchers, practitioners, policymakers, donors from around the globe. So there was initial conceptualization and drafting by the Male Engagement Task Force. And then there were several rounds of technical review and revision, specifically with the USAID Bureau for Global Health and their gender advisors. And that was followed up by an in-person expert consultation with partners and stakeholders from around the world. And even then, there was additional feedback provided from around 40 to 50 individuals who consisted of researchers, practitioners, donors, advocates from around the world. And last but not least, there was a large event that was held at a Male Engagement Task Force convening, during which the draft was presented and final feedback was solicited before finalization and initial dissemination. So as you can see, it was a really thoughtful and intentional process, and feedback was incorporated at each stage of this process to really ensure that it was really reflecting those best practices for engaging men and boys. And as I mentioned, we have ongoing translation dissemination. Next slide, please. So the do's and don'ts really coalesce around these key roles that men and boys can and do play. So oftentimes when we think about male engagement, we're looking at men as partners. So engaging men as equitable and supportive intimate partners. And the reality is that's just one piece of the pie. It's really important to think about these other two roles that men and boys can and do play, especially men as clients or users of health services, health information services and products, and also men as agents of change. So engaging men and boys directly and promoting gender equity in health. I think whenever we're thinking about male engagement, it's really important to structure ourselves, whether we're designing or revisiting a program and thinking about, are we addressing all these different roles that men and boys can and do play? And in looking at these roles, are we looking at these roles, how is it that we're looking at these roles? We need to be looking at these roles not only with men and boys and their relationships with others, but also looking at it from the angle of men and boys as individuals themselves that have their own health priorities and needs, excuse me. And I'm happy to delve, and there's not a lot of time to delve into this in more detail, but Neha, I definitely encourage you to go ahead and share these slides with everyone that has notes that really go more into what these different roles mean. Next slide, please. So now I'd like to just quickly review the do's and don'ts. The great thing about this resource is it tells us what we should be doing, but also tells us what we shouldn't be doing. So there's a lot of information on these slides that you all can review more in detail, but I'll just really quickly cover what the do's and don'ts are. So this first one is we really need to recognize and meet men's distinct needs. We need to acknowledge and meet their needs, again, across these three roles as clients, as partners, and as agents of change. Next slide, please. We also really need to remember that engaging men and boys should never be at the expense of women. This is really important to ensure that we have gender equitable engagement of men and boys. So it's really important in our monitoring and evaluation to be aware of the impact that our programming is happening on gender and power dynamics. Next slide, please. It's so important that we endeavor to seek to transform harmful gender relations and norms. We know that a best practice is starting any program with a gender analysis that can help us to understand what the gender and power dynamics are in a given context. And from there, we can really be monitoring whether or not we're shifting those harmful gender relations and norms. Next slide, please. Something that we really want to avoid doing is discounting the structural barriers that men face when accessing health services. For those of you who are more in the policy space, really thinking about the policies that come out of ministries of health or other ministries, especially as it pertains to health, they're often very gendered and they're very biased towards women and girls. And there's good reasons, of course, historically for this, for why this focus, but we really need to endeavor going forward to have more balanced gender representation in our policies. If our policies are really targeting women and girls, then everything that comes after the fact, the service delivery, is also going to be targeted towards women and girls. And this is an opportunity that we miss to really engage men and boys as clients and users themselves, and also as partners in those spaces. We need to have healthcare facilities with healthcare workers and providers and staff that are trained and equipped to be able to receive men and to provide them with services. Next slide, please. It's so important that we gather evidence with men and boys and not just with women and girls. So as we're doing our formative research for any program, are we interviewing men and boys? Are we learning about their lived experiences and what their priorities, needs might be? This is so important for us to better understand men and boys and how it is that we can address their priorities and needs in addition with those of women and girls. Next slide, please. This one, I think, is such an important one because it really just undergirds everything that I'm saying. This is a real mind shift to avoid starting with this assumption that all men are bad actors. I can say from my own field of sexual and reproductive health, that's often been a lot of the framing, is that men and boys are the enemies, and working with them is not at the service of women and girls. And it's really important that we check these negative assumptions about men and boys as a group, because not only does it unwittingly reinforce the gender binary and a lot of those negative gender stereotypes that we're really trying to shift, but also it means that we're not really seeing men and boys as individuals themselves with priority needs and isn't addressing what needs to be done to improve their own health and well-being. Next slide, please. It's so important to start early in the life course. I imagine so many of you already know this from your own work. Gender and social norms really coalesce very early on in our lives. So the earlier that we're able to start working with boys, especially, to be able to promote healthy decision making and actions, the better we can support them going forward as they're navigating gender and power dynamics across their life course. Next slide, please. I spoke about this a little earlier, but really want to emphasize it more here, that we really want to avoid overlooking the diversity of men and boys in the population. Men and boys are not a monolith. When we really drill down and look with a more intersectional lens, we can look at gender identity, sexual orientation, race, ethnicity, fatherhood, class, religion, faith, age. All of these things mean different, all of these areas have really different, all of these social classifiers have really different implications for what men's and boys' needs will be at different stages of their life course. And it's also helpful for us to better understand this diversity so that we can then strategically develop interventions to be able to support them at different life stages. Next slide, please. We also want to make sure that we're engaging men and boys as individuals and also in groups with other men and together with women. Many of you will be familiar with gender synchronization as an approach. And so really want to uplift the importance of creating male-only spaces to be able to have a lot of conversations, especially when doing reflection and introspection around gender and social norms and power dynamics. But also making sure that we're not only engaging men in male-only spaces. It's really important to thoughtfully and safely bring people together to be able to have these conversations about gender and power dynamics and think about the roles that we play in shifting them. Next slide, please. And this is the last one of the do's and don'ts. It's really important that we avoid overlooking scale and sustainability for achieving impact. So as we're developing programming and services, how is it that we can reach larger populations and communities and be able to sustain these efforts over time? This is going to be so important to really mainstream male engagement in different areas. So not just in programming and services, but especially in policies and and systems that really create that structural backbone for what we're able to do more downstream. So those are the do's and don'ts, a quick look at the do's and don'ts. Next slide, please. And I'd really like to invite folks that if you're interested in thinking more about male engagement, you're so welcome to join the Male Engagement Task Force. We are always sharing resources and networking and also creating opportunities through virtual events for us to have these thoughtful discussions together. And like I said earlier, we have a really good representation of folks across health-focused areas so that we can benefit from all the cross-learning and the work that we're doing. And I will stop there because I think we all really want to hear from Edgar about the work that that is being done in Mozambique. So thank you, Neha, so much for this opportunity to share the do's and don'ts with everyone, and look forward to hearing more about the work in Mozambique.
Oh, thank you so much, Danette, for that overview. I think that was such a great way to lead us into the next part of our meeting. So now I will turn it over to our next part of our presentation.
Hello.
Hi.
Yeah, you can hear me, right?
Yes, we can. And I am very excited to introduce these two people who will be really central to our meeting today. So I'll begin by introducing Edgar Bernando, who is a Mozambican sociologist and human rights activist. He is currently the national coordinator for Rede Hopem, the Men to Change Network, which is a network of civil society organizations and activists in Mozambique that promotes positive masculinities and provides men with skills to overcome gender inequities. He is also a lecturer at the Loyola University and a researcher at the Center for Human Rights, Health, and Society. We're also very lucky to have Dr. Richmond Aryeetey facilitate this part of the meeting. Dr. Aryeetey is the head of the Department of the Population, Family, and Reproductive Health at the University of Ghana. He is professor of public health and nutrition and a fellow of the Ghana Academy of Arts and Sciences. His research focuses on infant and young child nutrition and policy aspects of food and nutrition security. And he is currently a monitoring, evaluation, accountability, and learning expert of the Global Scaling Up Nutrition Movement Executive Committee. He also co-chairs the World Health Organization's Guideline Development Committee on Complementary Feeding and is a member of the WHO's Strategic and Technical Advisory Group of experts in maternal, newborn, child, and adolescent health and nutrition. Thank you so much to both of you once again for joining us today. And after the presentation, you will all have the opportunity to ask questions you may have, and you can also share those in the chat, but they will be answered once we move into the question and answer segment. We'll pause very briefly for a few minutes after the conclusion of both Edgar and Dr. Aryeetey's part of this meeting. And without further ado, I will turn it over to both of you. Thank you so much again.
All right, thank you, Neha. And I should say good morning and good afternoon, wherever you are, probably for some of you, good evening. And I'm excited to have the opportunity to facilitate this session. So, Edgar, can you hear me?
Yes, I do.
Yes. All right, good. So for your work that you have done, we would like you to start to tell us about it. And so perhaps tell us how you started to engage men in the work that you're doing.
Oh, hey. Thank you. I'm Edgar from Rede Hopem Men to Change Network. Is a Mozambican civil society organization. As a group of men, young people, we start as activists for women movements. One of the big women movement in Mozambique is called Foro Mulher. We start there with Foro Mulher, engaging different activities, and then we realized at that time, inspired by Men Engage Africa, strong gender justice, we realized the needs of having a movement composed by men in our contest to address message for men, to have dialogues with men. But to focus just on myself, how I start my interest work in this issue. It starts in the university. I was doing my degree in sociology, and I had a subject in that time, I think in 2010, called Gender and Human Rights. So all I know until now, it's many things what we discussed in that subject was really related for myself, the way we build the way we believe about gender, masculinity in Mozambique, mainly in the south of Mozambique, where I'm from. So I realized that, yeah, it's really time to change. We can do something, we can do different, we can have an important role in the society to change this reality. So it's where we all started. So, yeah.
All right, good. And you did mention dialogues as one of the ways to engage men, but can you tell us the ways in which you have engaged men in the work that you have been doing?
Okay, thank you. We have a different way, there are different strategies in place to engage men. One of our strategy, we have a program television called Men to Change, men-to-men dialogues. In Portuguese, it's Programa Homem que é Homem, so men-to-men. So it's a program where we invite different experts and regular people to talk about their understanding about gender issues and different topics. So it's an open section where people are able to discuss. We also try to engage different institutions. As you can see in that photo, we have policies, police. We also try to engage army, try to also being connected with this militarized and rigid masculinity. We know police and military are most rigid, but we also try to be engaged with them to build and construct a different way of being a male. We also, I think you can move on to another slide. We have a program we call Art Without Violence. So we engage young people to be with us. We engage poetry, musician, different arts, usually we train this different group in gender issues, let's say HR, GBV, and so on. And we invite them to use their art to do something regarding to this topic. And as you can see, there we have a declamation and another activities. We award people, so it's fun and it's a hobby for many people, being there, relaxing, chatting, have a nice moment, but also learning about the different things. We have musicians who are engaged, who compose different songs against child marriage, against GBV, and so on. We have poetry, we have so many things in place. So this is also another important program and really interesting because young people, adolescents also get excited to be in the movement like that. You can move. Okay, soccer is also another way we use to engage young people. Soccer for change. It's not about just playing. There are different rules in place, not being aggressive, because in case someone do something wrong, do something harmful, it's not the individual, like I can say, sanction or punishment, but all group, all the team will be, maybe can be eliminated, things like that. So it's a way to practice self-control, even in situation of hunger, even you are real made with some situation, it's a way to control yourself. It's a way to communicate in a good way. So we don't allow insults. No one can insult another one during the game, and another rules are in place. We also use this moment before starting the game. We have dialogues about the topic. In each moment we choose some specific topic to talk about. So we use before, between, and after the game. We have dialogue. We have different activists there. The people who hold the balls here. Our activists. So they, before the game, during and after the game, they are there sensitizing, talking with this player. So we also consider this an interesting way to engage young people in our debates. So now we are trying to also extend to another sports, like how to engage also girls in our activities, in sports activity. We didn't start that till now. We are focused on men, but we also see a way to engage different genders and different sports. You can move. Another slide, please. Okay. We also have another interesting program, Men in the Kitchen. Basically, in this program, men are invited to learn about nutrition. You know, we start this program engaging what we call in open pregnant couples, people, partners who are waiting for a baby. So we engage them in nutrition program, teaching them how to cook, teaching them about nutrients the baby and the pregnant women needs. How can men can be engaged, can be more involved for the health of his wife, the children, and also for his own health. So we encourage and we engage men to be in kitchen. So in this program, we deconstruct the idea of the kitchen belongs to women. So we deconstruct this idea and show everyone that kitchen is for everyone. Everyone can cook. If you are a human being, you need to eat. And if you need to eat, so you also need to learn to cook. It's a basic issue, you know. Cooking, there are no gender in terms of cooking. It's a basic, it's a human needs. So it's interesting to have men in this program, also have boys. There are some interesting things happening in these activities when we teach them, men to be mainly adolescents, when we teach them to be engaged in domestic chores. They most of the time come to us like, oh, Uncle Edgar, I'm trying to implement what you teach me, but my mother, my father, my parents don't allow me to do it, you know. They keep engaging my sister in this topic. So unfortunately, we have been facing this kind of thing, what showed the importance of also engage the parents, engage the community, engage it's important to have a sociological approach, like involve a socio-ecological approach involving all spheres of the society. You can move. Next slide. Okay, That's with Love. It's quite connected with the previous program. That's with Love most of the time also engage couples who are waiting for a baby, but also single people, but also young people, including adolescents, because we consider that it's important to prepare young people since early age, not waiting for them to to grow and then start to teaching this thing. It's important to deconstruct hegemonic masculinity in the early age. It's important to bring, to build new perspective, different ways of seeing themselves in the early age. So in this program, we train men on positive parenting. So basically, we teach men how to take care of their children. We talk about being involved in prenatal consultation, vaccination, partum, postpartum, and so on. It's also connected, as I said before, with that other program, because we also have a dialogues about take care of the household. We also including cooking, doing all domestic chores, and try to deconstruct the idea of the house. It's a feminine place, but have them more engaged in this field. There are some interesting results we have been seeing in this program. Now I can give an example of a woman for a district on the Nampula province where we're working days ago. And she told us, this is my third baby. With my first two babies, I always experienced violence from my partner. Like even during pregnancy, he always beaten me and so on. But since your program started, I can see love in my house. I never saw violence anymore. So for us, it's really inspirational. Like it's real motivate that, yeah, something is real change. And then additional things, even in the partum process, the man was there waiting for the women. Unfortunately, our maternity don't have a nice structure to have men inside, but he was outside waiting for his wife. For her, it was a real new situation. She never had such a situation before. So again, it's meaning that they have really impacted. Men change their behaviors, their attitudes, the way they see things. Okay. Next slide. 1 minute still have.
So if you can go to one more and then we can go to the questions on lessons.
Okay, great. Men-to-men dialogues, it's another program. So basically we get men and boys discussing about different topics, gender, so GBV, family planning, and so on. It depends on the specific program, but we try to include different topics also. Next slide. Just to fit it. Boys Club is also an important, like this club is just to engage young people, boys, adolescents, and we also have graduation. So we graduated people, we call them like role model, okay, role model boys. We graduate them after 13 sections. So we have a package, we follow the package. After 13 sections, they engage it, we graduate them. We try to engage community structure also. We engage different institutions, health, education, institution, and so on. I think you can go to the last slide in terms of lesson.
Yes. So if you can share some lessons you have learned.
Intervention of men and boys is that, so we have some lesson here. The first one, intervention of men and boys must always be aligned and implemented in continuing partnership with those targets at women and girls. Danette also mentioned this. We also think it's important. It's important to understand that gender is relational, so it's important to have a continuous synchronized approach. Gender equality is above all human rights issue, but it must also be promoted as a public good with benefit to everyone. I think here it's also aligned with what Danette say. Most of the time we engage men and boys as a partner, but it's important to also engage them as clients, understand that they have needs and must be benefited with the intervention we are implementing. You know, a change of male attitudes, behavior, and practice needs to be sustained over time. Men are part of the system that needs to be challenged itself, engaging family, communities, government structure. I also mentioned this. And the last thing, dismantling masculinity is a collaborative work that must engage all sectors of the society. I think it's part of collaboration, the reason we are here. So I think it's important to keep collaborating. It's important to keep learning from each other to strengthen our program. Thank you.
Thank you very much, Edgar. This is quite exciting hearing this from you, and I'm sure there are people here who would want to be, you know, engaged in this kind of work or are currently engaged in this kind of work. Do you have any advice for people who are working in this area or who want to do this kind of work based on your experiences? Hello, Edgar.
Sorry. I think that my advice can be like, we need to also assess men's needs. Again, I have to be aligned with Dan when she say that, and I think it's also our approach. Most of the time, we engage men as partners, as agents of change, and most of the time we are missing them as clients. It's important to also try to assess their needs. It's important, because if you always time we just go there where you engage men to improve women's, etc. Engagement to, it's like, hey, we're just here to do things for women. What about me? So it's important to make them aware the benefits of gender equality. What's the benefit they have in this process? It's important to synchronize and show them permanently that day. It's not just a women issue, it's you issue. It's change your situation, it change your status, it change your life. So I think our grammar needs to improve. We need to have a proper way and strategy to engage them more and more. The good things is I can see that men's, mainly adolescent people are interested to be engaged of this, but we need to improve our strategy. Over time, we need to keep thinking how to really engage them in this issue. Thank you.
Thank you very much. And let me just end by saying that what you have shared with us, for me, one of the key values of it is the fact that you can create diverse opportunities for men to engage with men, but also to engage with boys. And then you are thinking of even bringing girls to those conversations. I think this is really great and helps us move the kind of work that we are doing in our various projects forward in how to ensure that men play a key role in it, not just as facilitators, but active participants in that. So thank you very much, Edgar, for sharing this, and I'll hand over to Neha.
Thank you so much, Edgar, for sharing those experiences. I think I can speak for all of us here, and I'll echo what Dr. Aryeetey said, but you know, it was incredibly interesting and very inspirational to hear about all these approaches and strategies utilized. And the lessons learned really touched on some very, very important considerations and things to keep in mind for engaging men overall. And thank you very much once again, Dr. Aryeetey, for doing such a lovely job facilitating. And I will now pause very quickly. If people have any questions to share, either through chat or you can come off mute, but I see we do have one question that I think might be worthwhile to pose to the larger group as well. And that question is, let's see. How do you engage the conservative, traditional or conservative minded men when doing these activities? Is there any suggestion on how to best engage with them, and what comes to mind with that? And I can, Edgar, I don't know if you, I know you turned your video off, but it would be great to hear if you have any thoughts to share on that in response to Rael's question.
Hello?
Hi. Were you able to hear the question?
Yeah, so how to engage conservative people? It's a real challenge, and sometimes we face some backlash in our context also. Religious people, yeah, we also have people who are resistant in the name of culture. I think the thing is we need to improve our evidence. It's important. Our intervention need to be aligned with research, with evidence. So it's not about just talking, but we need to show the evidence of the benefits of some specific intervention. We know that, okay, there are people, even we show 1 + 1 is 2, they will still resistant. But I think we need to keep talking about it. We need to found allies between them. And most of the time, when we engage them as a group, so can feel sometimes, okay, sometimes we have been held meeting with religious people. And during the meeting, we try to capture who is more open to have a discussion with us. So we try to engage them separately and have them as agents of change. We have in Mozambique Muslim, Christian people who are really engaged with us, talking about even sensitive issue like abortion. They are now talking about this and try to sensitize their fellows. So I think it's one of the way to do it. I consider that another way of working with them, mainly it's keep promoting different trend, different dialogues. We know that change takes time. Fortunately, sometimes we need to feel, or fortunately, we need to see change immediately. But sometimes change takes time. We need to be patient. So yeah, this is the way I'm saying it.
No, thank you so much, Edgar. That was such a great response to that pretty complicated question that was posed, but it was a very good question. So it looks like we are receiving a few more questions in the chat, and given the size of the group, I think it'll be worthwhile to continue the conversation like this. So the next question that we can hear from you on is, what barriers did you see in changing men's behavior? And I think there are a few other questions that might speak to this as well, but please go ahead.
Yeah, so unfortunately, sometimes, the barriers come from different ways. For example, we engage men, adult men, like, okay, you need to go to do domestic chores, and when the men go home and try to be engaged at home, sometimes is his wife who say, hey, you can't do it, you can't do it. What people gonna say about me? It's like, I'm controlling you. It's like in Mozambique, we have expression meaning that, yeah, you put your husband in the bottle, so it's like, what people gonna say about me? It will be like, I put you in the bottle, I'm controlling you, I did something like to make you weak, something like that. So it's important also, again, thinking synchronized approach and also transformative approach, engaging all the community. I think we need to keep doing it, because we can work with this man, but his wife will be a barrier, the mother-in-law also can be a big barrier. Also, it's important to engage them, because we have situations where the mother-in-law came at home, and say, hey, what's going on here? Why my son is doing it? Why is it going on in this way? So it's important to engage all structure of the society. I shared before the challenge young people, adolescents also have been facing. They want to change their attitude and practice, but when they go home, is their parents who stop them, like, hey, you can do it. This is women issues. So it's another barrier. I can mention the last one. We have so many barriers, but I can mention the last one, mainly in the health system. We have been working to engage men in health system, particularly in maternal and child health. And yeah, when men are there, sometimes it's health professional who say, hey, it's not your place here. What are you doing here? When the man is with the baby, hey, what are you doing with this baby? Where is his mom? So it's also important to engage health system to try to deconstruct their mentality about care, about men's presence in this field. So in each field, we can find barriers. It's important to keep access to the barrier and work to overcome them. Thank you.
Thank you so much, Edgar. There are a few more questions, and there are actually some very great questions here, so I'll maybe continue if you don't mind. So let's see. So I see one here, and someone is interested in hearing more about the pregnant man intervention. I think maybe if you don't mind, perhaps you can share more information about that and we can circulate that through our email after, because there's some other questions that maybe we can come back to this one, but there's some other questions that might be really interesting to hear directly from you from. One of them is talking about the planned sustainability solutions for male engagement. And I think that is a looming question with a lot of our work, but it'd be great if you could speak to that a bit more.
Yeah, sustainability is always a challenge. We have so much to do, but the resources are never enough. But what we have been doing to ensure that our programs are sustainable is to engage different institutions. We try to engage education sector, health sectors, and another local institution. We work with different groups of women. We work church, religious groups, saving groups, there are a group of women who saving for different needs. We also try to engage them. So even after the program, they can keep working. We work with community appeals, agent, polyvalent, community health agents, community health agents. So it's meaning even after our program, things can keep in place in a specific community. So I think it's important to keep engaging with local structure. So it means that even after the program, things can carry on. I can mention also the radios. I can mention midwife is also part of the structure we involve in our program. So it's also important to try to identify, before implement, it's important to identify the main stakeholders. It's important to identify partners, allies, different institutions can come together in the work we want to do.
Wonderful. Thank you so much, Edgar. And there's another question here. How do you balance addressing men's needs and addressing program barriers, I guess, at the same time? And you might have spoken a little bit to the barriers, obviously, in the previous question, but if you have anything else to share in response.
I didn't get the point. It's how to address the barrier, is it?
I think that they're just two different forms of barriers. I guess, one is men's needs and also just larger programmatic barriers that you might encounter when moving forward with these activities. So I think given that those may present themselves simultaneously, how do you maybe modify your approach? If Elizabeth, you would like to clarify, please go ahead. I don't mean to speak on your behalf.
Thank you. I think you're actually right. So I'm talking about, he spoke about various men's needs. So as part of the program, they try to understand what are some of the men's needs. And I believe they speak about all of these various needs, from finances to different aspects of men's needs. And then we have the program barriers arising as a result of trying to involve the men. So in essence, how do you generally balance this to ensure that you've both addressed some of the men's needs and you've also addressed the program barriers? Thank you.
Yeah. Again, as I said, unfortunately, as organization, most of the time we also engage men as partner, as agent of change, and we most of time or always we fail in terms of engage them as clients. So it's mean if we fail in this field, it's meaning that most of the time we don't work to really know what the man needs in a specific area, the specific moments, you know. So this for us is still a challenge to really work. Now we're reformulating our strategic plan, and one of the things we are bringing it's men's health. We never talk, we never mention about men's health. It's just men engagement to improve women's and child health, men engagement to improve nutrition of women's and girls. And this is really challenging for us, even for us. We are now start learning and trying to assess men's needs. So this is something that you need to be aware of and try to avoid during our process. It was making sense to us in the moment we starting our engagement, our process, and the way we are coming from feminist and women movements, addressing some specific topic. It was really making sense to do what we are doing, and it still makes sense. We still need to do it, but we also consider it important to bring another topic and also focus in men's needs. I can't now bring specific issues because it's something that we still need to learn more to really engage men as clients.
Thank you so much, Edgar. I think maybe Elizabeth, you seem to have one more question here, and that was again just elaborating a bit more on the pregnant man work that was done. We can maybe do that in the next minute or so, and then I can go ahead and close the meeting.
Sorry, so I was just giving feedback. I said that's very helpful feedback, and thank you.
Sure. Wonderful. Well, I really appreciate all of these thoughtful questions, and thank you once again, Edgar, for such a wonderful presentation. I think there's a lot to take away from what you shared, and it was much appreciated how you fielded so many different aspects of male engagement, even in this question answer as well. So thank you so much. And with that, before everyone signs off, I would like to launch a poll just to get a sense of reactions and thoughts related to this meeting. But to close, thank you again for joining us today and participating. And we will share out the recording and the notes from this presentation. And if there are any other questions, feel free to follow up with us and I can pass them on. And I'll launch the poll now, but thank you so much again. And I hope you're able to join us at our next meeting, and we will announce that through the listserv. And thank you all. I hope you have a wonderful rest of the day. And thanks once again for joining us today.